plastic processing is very, very difficult. And so it just really didn't sit well with me as a pharmacist that I would be dispensing something that was going to just end up getting shipped across the oceans to my home country and just dumped in our lands to pollute our waterways. My name is Melinda Su-En Lee, and my title is CEO and co-founder at Parcel Health. When I was growing up, I really wanted to run for office. I really wanted to be a politician, to run for office in Malaysia. I grew up in Malaysia. You know, those were the people who were in power, who were able to enact change, right? Lay down, laws and regulations that could protect the everyday person. All the women in my family are very, very strong. They're all leaders. We are a family of small business owners. And so, my grandma ran a hot pot restaurant, and my maternal grandmother had, a business till their retirement. And so for me, this is just, to a certain extent, carry on the family legacy in a different way. I was the eldest in a family of four, and I came to the US when I was 19 for college. Went to New York for college, and yeah, there was definitely a lot of culture shock. I didn't know how to shop for the different seasons, so I didn't know. I had never bought a pair of boots before. So it was really tough. The first year was really, really tough, but it definitely built a lot of resilience, definitely helped me saw a very different side of life. Obviously, growing up in Malaysia, I'd always grown up as, a citizen. I always had this sense of place, like I belong here. And then to come to the US and really now have this very different experience. Now I'm the immigrant, right? And now I say weird things that people don't quite understand. We grew up in a British English system. So there were a lot of things and a lot of expressions and a lot of spelling that I did that was British English. Like when I asked the taxi driver to open up the boot, he just looked at me like, what? And he was like, it's called the trunk here. He was like, when you're in Rome, speak like the Romans do. I was maybe like 11, and I would go with this teacher to volunteer at these recycling facilities. And people would just bring their recycling to us, and we were manually sorting it for recycling. So plastic, paper, and trash. And I did that throughout my childhood. And fast forward, I just saw how horrible that problem was. And fast forward to me coming to the US, and I went to pharmacy school, and then realizing that, I was dispensing just hundreds of thousands of these plastic pill bottles. And I'm like, oh my gosh, this is all going to Malaysia. Malaysia, in recent years, became one of the largest acceptors of plastic waste from the United States and Europe. So a lot of the plastic waste that we generate here in the United States gets sent to Malaysia for processing. But it doesn't, plastic processing is very, very difficult. And so it just really didn't sit well with me as a pharmacist that I would be dispensing something that was going to just end up getting shipped across the oceans to my home country and just dumped in our lands to pollute our waterways. I went to pharmacy school, really wanting to be part of the medical and the healthcare system. There was just this photo that really stuck with me when I was younger. And it was this photo of just like, a beautiful city on one end, right? There's so many skyscrapers. And then on the other side of it was just the amount of industry that was just polluting it in order for the city to persist. And that is something that really stuck with me in my childhood. I fully, I loved the practice of pharmacy. I, loved my time at pharmacy school. But when this problem came to mind for me, I just could not shake it. And I can't explain it other than this was a problem that just bugged me from day to night when I was in pharmacy school, and I just couldn't get it out of my head. And in my head, I was like, if a pharmacist would not step up to solve this problem is not going to get solved. At Parcel Health, we fill medicine cabinets with safe parcels. And what that means is currently we are replacing orange plastic pill bottles, the ones that you get at pharmacies. We're replacing it with a paper-based paper pill bottle called the Tully Tube.
So this one is, the smallest one is 50% less plastic, and these guys are up to 75% less plastic.
It is not only regulatory compliant, it's humidity resistant, water resistant. It's also completely light proof when it's shuttered. It is extremely sturdy, so it is much sturdier than plastic. And finally, because it's made of paper, it's just much, much more environmentally friendly. I think one of the earliest and probably the most discouraging at the beginning, there were people in the pharmacy industry that was like, nobody cares about these pill bottles. They're so cheap and we use so many of them. Nobody cares, right? Nobody cares that it's ugly. Nobody cares that it's plastic. Nobody cares. And they would just tell me like, just focus on your pharmacist career, right? Like, but then on the flip side, there were also really inspiring leaders in the space who have started companies who are pharmacists who, when I approached them with this problem, said, that's a really unique problem. I think that's worth solving. I've loved working with Catalyst. Not only did they provide an investment to help us accelerate the growth and our strategy, but they also provide the healthcare team, which in our case would be the pharmacy team, that provides us feedback, that provides us a place for us to pilot the product. I think working with Catalyst has been one of the most amazing experiences for us to be able to meet an investor and also a stakeholder / customer that was so invested in our success. At Parcel Health, we're on a mission to fill medicine cabinets with safe parcels. So our goal really is to, at first reduce the amount of plastic that is being used to package medications, but ultimately it is to completely replace plastic from our healthcare supply chain.